We use cold therapy with our patients just like you would if you had an injury and you've been told to place ice on your injured part. We use it after surgery to produce this vasoconstriction, which is the narrowing of the blood vessels, and that decreases the chemicals that produce the pain at the nerve endings. It decreases the swelling, and also importantly to me, it helps decrease the postoperative bleeding inside the mouth. The science behind cooling after surgery is similar to what I just said. The concept is to use cold to cause vasoconstriction, or narrowing of the blood vessels to the surgerized organ. And then that decreases the chemical response to trauma or surgery, the decrease in the pain chemicals, the decrease in the chemicals that cause swelling to the tissue, as well as the decrease in the blood flow to the area. We've definitely noticed significant results. In fact, over the years, the 20 years that I've been doing surgery, the AqueCool has given us the greatest results of any other additional technology that we've tried over the years. And the three biggest or most dramatic changes we've seen with the AqueCool are, number one, a decrease in the pain following surgery, which is greatly beneficial to the patients. A significant decrease in the swelling. And most important to me is there's been a decrease in the postoperative oozing or bleeding. When I come in to see my patients the next morning after the surgery and examine their mouth, the surgeries are all done intraorally, the mouths are usually clean and healthy and no signs of blood. And that's in contrast to before, where you'd come back and there was always lots of blood and clots inside their mouth. Today I come and I hardly see any. And so it's been a very dramatic difference from my perspective. Yes, the patients have been very satisfied because their main interest when we talk to them about their post-operative recovery is they want to reduce the pain and they would like to reduce their swelling. And we simply tell them that today the best way to achieve those two goals is to use the AqueCool compression device.
I had orthognathic surgery, which is they had to break both my upper and lower jaw, and I had it 4 weeks ago today. I used the AqueCool because I heard from my doctor that it was better for swelling and pain, and it would reduce a lot of the afterwards effects that you wouldn't get, or that you would get anyways. The specific ways that the AqueCool helped me were, it helped with a lot with the swelling. My mom had the same surgery about 20 years ago and they didn't have anything like this. And when she saw the results of my results after the first few weeks, she noticed that her swelling had not gone down the same amount for at least 6 to 8 weeks after the surgery. So it was helped out a lot there, and it helped with if it was off for too long, I felt like my face would get really hot and it would start to throb a little bit. Once I put it on, it felt a lot better. I used the mask pretty much when I wasn't eating. We'd put it back on and it was just helped a lot with the throbbing and the things that you'd feel. The AqueCool definitely reduced the discomfort. There was not a whole lot of pain, probably because of the AqueCool, but it really did help a lot with discomfort. My advice would definitely be to go with the AqueCool. It's just a lot easier to use than ice packs and things like that. It helps out a lot, helps with discomfort.
Well, what I like the most, as well as the caregivers and the nursing staff, is simply the convenience. Because it's so easy to use, you simply put it on and turn it on and everything else takes care of itself. And that's in contrast to the old school method where we had to use the jaw, bra, and polar ice. They were constantly having to deliver little bags of ice. I think the patients are more than willing to pay for the device to help decrease their pain and swelling. Our patients are given the choice between the AqueCool system, which is not reimbursed by medical insurance, or the old school system, which is provided by the hospital, which would be the ice bags. So that's provided free. But pretty much 100% of them, when they understand the benefit, will choose and pay for the AqueCool device. The AqueCool system is not difficult for the patients and the caregivers and the nursing staff to use. We generally place it on the patient while they're asleep in the operating room and pretty much leave it on until the next morning rounds. And that's when we take it off and show the nursing staff and the caregivers how to place it back on, how to change the water in the reservoir, and check the temperature setting. But it's very easy to use, and there have been zero problems with the nursing staff and the patient caregivers using it. Well, my message to other doctors who are not using it, who are using the old school compression device, is that this has been a huge benefit. In fact, of all the things I've added to my practice of surgery over the years, this has shown the greatest benefit to the patients, the caregivers, and myself. It's had a huge decrease in patients' pain after surgery, the swelling after the surgery, and most remarkably has been the postoperative bleeding. Those three things have made a dramatic decrease and have benefit for the patient. So I would highly recommend it to other surgeons who are doing facial reconstructive surgery. The top three reasons I would recommend the AqueCool to other doctors would be, number one, the patient's decrease in postoperative pain. Two is a significant reduction in postoperative edema and swelling. And thirdly, which is the most surprising, has been a decrease in postoperative oozing and bleeding. There's actually almost none after the surgery. When we go back and look at the patient's mouth, they're extremely dry and clean and hardly any oozing at all. That's made a big difference. Both the hospital staff as well as the caregivers simply like the convenience of the device. You simply put it on, fill the reservoir, turn it on, and then there's little to do with it throughout the day, as opposed to the old school ice packs, which had to constantly be changed and tucked in and were quite uncomfortable.